Hello everyone, welcome back to OptoInsight. If you watched my last video on Ectropion, you already know that eyelid conditions can be tricky and sometimes confusing. Well, today we are diving into another eyelid issue, which is ectropion. Now, while entropion is when the eyelid turns inward, ectropion is the opposite. It happens when the eyelid turns outward, away from the eye. So in this video, I'm going to explain what ectropion is, its causes, symptoms, and how it can be treated. By the way, if you have not checked out my video on Ectropion, I will link it in the description below. It's a great primer on eyelid disorders and gives you some context for today's video. So let's start with the basics. Ectropion is a condition where the lower eyelid turns outward away from the eye. This causes the inner surface of the eyelid to be exposed, which can lead to dryness, irritation, and other complications. Think of it as the opposite of entropion. With ectropion, the eyelid can't properly do its job of protecting the eye, leading to a range of symptoms from mild irritation to more serious eye issues. Now you might be wondering what causes ectropion. Well, there are several factors that can lead to this condition. The first one will be age-related changes. As we get older, the skin and tissues around the eyes naturally lose their elasticity. This can cause the eyelid to sag and turn outward. This is called age-related ectropion, and it's the most common form. Ectropion can also occur when the facial nerve is damaged, which is often due to conditions like Bell's palsy or stroke. This controls the muscles around the eyelid, and when it's not working properly, the eyelid can droop and turn outward. Also, any injury or trauma to the eyelid or the skin around the eye can cause ectropion. This could be from a burn, surgery, or a scar that pulls the skin downwards and preventing the eyelid from staying in its normal position. And another cause of ectropion is chronic inflammation. Chronic conditions like blepharitis or conjunctivitis can lead to inflammation of eyelid, which in turn causes the eyelid to lose its shape and elasticity, also resulting in ectropion. How can you observe and notice the symptoms? Well, the symptoms are pretty noticeable. Here's what you might experience. Because the eyelid is not properly covering the eye, your eye can become dry and irritated. You might feel like something is constantly in your eye, like a foreign body sensation. Interestingly, you may also experience excessive tearing. This happens because the tear drainage system is not working as well when the eyelid is turned outward. The exposed inner surface of the eyelid can lead to redness, swelling, and even inflammation of the eye itself, which can cause further discomfort. Since the eyelid is turned outward, you may have difficulty closing your eye completely, which can make it harder to sleep or keep the eye moist. So, what can you do if you have ectropion? Well, the treatment depends on the severity of condition. For mild cases, artificial tears or lubricating eye drops can help keep the eye moist and reduce discomfort. And in some severe cases, surgery is usually required to correct the eyelid position. Procedure typically involves tightening the skin and muscles around the eyelid to bring it back to its normal position. In some cases, taping the eyelid can help temporarily hold it in the correct position, especially if the problem is related to facial nerve issues or aging. Now, if you notice symptoms like constant dryness, irritation, or difficulty closing your eye, it's important to consult with an eye care professional as soon as possible. Left untreated, ectropion can lead to more serious complications like corneal damage or infection. Let's wrap up our look at ectropion. As with most eye conditions, early detection and treatment are key to preventing complications and ensuring the best possible outcome for your health. If you found this video helpful, please give it a thumbs up, subscribe, and hit the notification bell so you never miss another eye care tip from OptoInsight. And don't forget to check out my previous video on Ectropion. I will link that below if you want to dive deeper into eyelid disorders. See you in the next video.